Like a lightning bolt, imagine sharp, shocking pains shooting through the side of your face, lasting just seconds or even minutes. The pain is excruciating. Experts say it's the worst agony known to man, and thousands of Americans are suffering in silence. The condition, trigeminal neuralgia.
The pain started in September of 1999. It started as a dull ache in my teeth and in my ear and generally in my face, and it progressed into stabbing pains in all of those places.
Trigeminal neuralgia, also called tic douloureux or just TN, is a disorder of the nerve that lets you feel anything touching your face.
Trigeminal neuralgia, tic douloureux, spasme scenique, it's been called many things over hundreds of years. But what's clear now is that it's a short circuit in the nerve, and it's caused by an artery or a vein that's bouncing up against the nerve in a sensitive area. It strips the insulation. So every time there's a breath of air that comes across your face, you speak, you swallow, you chew, you kiss someone, electricity goes through the nerve, you get a bolt of lightning in your face. That's what trigeminal neuralgia is.
It usually starts late in life. Once the pain starts, even the lightest breeze brushing your face can explode with pain. People with TN live in terror. They avoid brushing their teeth, putting on their makeup, or leaving the front door of their house open for fear of a gentle breeze. They can be suicidal.
The pain definitely affected my social life. One of my triggers is vibration, so even riding in the car was excruciating. It affected my family in a horrible way because they were always worried and always wanted to be able to help me, and they felt helpless. It affected my career in a negative way because I was fired because I had this illness.
TN is often misdiagnosed as a toothache or migraine. As a result, patients can spend years searching for an accurate diagnosis and treatment. Today, there is hope. Patients who educate themselves, find a knowledgeable doctor, and obtain an accurate diagnosis have a chance at successful pain relief. Medicine can work, but only for a while. Then surgery is needed, often a brain operation. It's called microvascular decompression, or MVD. MVDs successfully relieve the pain in about 75% of patients.
It requires a patient to be asleep, and we use computers to design an incision behind the ear to make an opening in the skull, an opening in the covering of the brain, and bring in a microscope and look at the trigeminal nerve, find the artery or vein that's pounding against it, and using careful technique, move it away. As soon as the patient wakes up, 90% of the time, the pain is gone.
Marilyn tried several other surgical procedures before microvascular decompression. Today, she wishes she had undergone MVD sooner.
I would advise anybody who has been diagnosed with trigeminal neuralgia after they have taken the medicinal course to have microvalve decompression surgery, because the more treatments, surgical treatments that you have, the less likely it is that the big one will work.
For 20 years, TNA, the Facial Pain Association, a nonprofit organization, has supported patients with trigeminal neuralgia and other neuropathic facial pain disorders.
The mission of TNA is to help those with trigeminal neuralgia and nerve-generated facial pain with access to information, encouragement, and support, and we are also charged with finding a cure through translational research. On a specific day-to-day basis, we're trying to cut down the wasteful period, time, that elapses between the onset of disease and proper diagnosis.
TNA serves more than 30,000 patients and their families, offering education and support through its national office in Gainesville, Florida, and its award-winning website, tna-support.org.
When I touch base with people online that understand how I feel, it validates my feelings and the pain that I have, and just as extremely important as a support system.
TNA also educates doctors and dentists about the symptoms of trigeminal neuralgia and other facial pain disorders, pushing for more research and better treatments.
We reach out to the medical community, starting with our medical advisory board, which is made up of professionals who are experts in facial pain and trigeminal neuralgia. They help us by populating our website with articles, and a couple of them have also published books which we make available to patients and to the medical and dental community. We also conduct conferences around the country, and these conferences are available to medical and dental professionals, and they can earn educational credits through their attendance. We also have an award-winning website, which is the #1 resource for anyone who is interested in trigeminal neuralgia and facial pain. And lastly, we have now developed a curriculum for dental assistants and physician assistants that we will be presenting at medical meetings around the country.
Support TNA, the Facial Pain Association. Together, we will end the pain.
The future of TNA, if we are to be successful in our mission, is that we must reach more patients. Trigeminal neuralgia is known as the suicide disease and the most painful affliction known to mankind. We believe that there is a silent epidemic, and we must therefore reach out and reach more and more people. Also, this disease has been around for thousands of years. We do not know the cause, and we have no cure. It is up to us to foster translational research to find a cure.
For more information about facial pain disorders, visit tna-support.org.